Good afternoon and welcome to our OakBend Medical Center Happy Hour podcast. My name is Donna and I am your host. I'm very excited to introduce our guest today as we speak about the different programs offered at OakBend. Joseph Freudenberger is Chief Executive Officer of OakBend Medical Center, an independent nonprofit community hospital system. In 2018, Joe received the Houston Business Journal's Most Admired Nonprofit CEO Award and winner of the Ernst & Young Entrepreneur of the Year Award in 2017. You may recognize Joe from his social medias every week, giving us updates of COVID and keeping us posted in the community. I also want to wish him a belated happy birthday and welcome, Joe. Thank you for coming on today.
Thank you, Donna. It's a pleasure to be here. I look forward to sharing next few minutes with you and your listeners.
Great. Well, now that 2022 is here, what are the plans for OakBend Medical Center?
Well, I sincerely hope it's let's get back to normal, doing the things that we like to do without having to worry about COVID-19. So as far as normal is concerned for OakBend, that means continuing to grow our services so that we can meet the needs of our growing community. We're adding new doctors to our medical group and to our community in obstetrics, family medicine, orthopedics, cardiology, and a variety of other areas that we have an interest in. So we're looking forward to a great year. We've got some new programs. We're bringing in a new manager over our wound care unit that has national expertise in the area. And we're beginning our affiliation with Sam Houston State's Medical School. And we'll be talking about that, I think, a little later in the podcast.
Absolutely. Right now, what's on everybody's mind, we all had hopes of 2022, COVID was going to go away, and here we are. Are we seeing the COVID cases again on the rise?
We are back up into the 20s, though thankfully we have not breached the 30 barrier. So we have seen another surge. It has not been as widespread in terms of hospitalization. We think that is due primarily to the fact that folks are largely vaccinated. They may be getting the disease, but they're not getting a severe case of it. Omicron is also thought to be a little less severe, less likely to get into the lungs and cause severe breathing problems. That said, we still see certain number of people who get severely ill, who end up in the ICU on ventilators, and some of whom don't make it out of the hospital alive. So I would caution everybody not to let their guard down. Let's hope that 2022 is a turning point in this pandemic. But until we have clear evidence of that, I would caution everybody to maintain vigilance.
So there's so much controversy around the vaccinations and everything. How are your staff doing with vaccination?
We are at 90% vaccinated at the OakBend Medical Center. So you can feel comfortable if you come to this hospital that our staff are doing everything they can to protect themselves and you from getting this disease.
This pandemic has been so difficult on staff. How is your staff doing?
It's rough. It's really, really rough. The ER staff has been hit with now 3 waves of this pandemic, which has absolutely overloaded the department, causing us to have to hold patients in the ER waiting for inpatient beds to become freed up. Our ICU staff has had to deal with patients who oftentimes are put on the ventilator for 2, 3, 4 weeks, and many times don't make it, which is very depressing when you give your heart and soul to help a person get better and they don't make it out of the hospital. It's not what our ICU nurses signed up for here at OakBend, or for that matter, anywhere in the world. They're here to help people get better, not to watch them die. And this is not unique specifically to those units. This is true in our COVID units and our non-COVID units, because everybody has been affected one way or the other by this disease. It's been very, very tough on our healthcare system, and my appreciation goes out to our staff for soldiering through. And soldiering is the right word. This has been a battle, and our staff have had to become battlefield warriors.
Joe, you've headed up a COVID committee. your staff has done everything they can to help this community with COVID. What could the community do for us to help our staff feel supported?
Well, I think thank you is the most powerful thing that you can say to a healthcare worker. Thank you for taking care of my family, our community. Thank you for toiling away without the recognition that you deserve. And how do you say thank you? Well, we all know people that work in the healthcare field. And I think just telling our friends and our neighbors who are in the healthcare field, thank you for all they do. It is so, so powerful for somebody to randomly come up to me if they know I'm the hospital CEO and say thank you. I can't begin to describe how good it makes me feel, and I know it makes everybody else in this profession feel the same way.
I agree. And these guys have been working really hard through staffing challenges and everything else, and they have done an amazing job. So while we deal with the COVID and everything else, we still go with making our services better at the hospital. And you touched on it. We're working with Sam Houston University. Can you expand on that and what that will mean for the community?
So Sam Houston State University has established a medical school. They have started classes. They in fact started last year. This is their second year, and they will be doing clinical rotations. The students in the medical school will be doing clinical rotations in year 3, which will be forthcoming starting in the summer of 2022. They do mandatory rotations in year 3 and then elective rotations in year 4. And we will be a site where they can do both of those rotations. We're very excited because when you introduce medical school students to a hospital, your probability of being able to attract them to this community goes up dramatically. And having good quality physicians that are committed to our community is an essential part of establishing a good healthcare system. So we're excited about that. We're also excited because I have found in watching my son do rotations here, that we offer really a very high quality experience for medical school students. They actually learn a tremendous number of things because in a community hospital, we do everything. We don't have all the super subspecialists that they might have down in the medical center. So medical school students who rotate here get a much broader variety of experiences in their respective area where they're rotating. So it's going to be good for both parties, the students as well as the hospital, and also by virtue of the community.
Awesome. Now, I understand that we have a skilled unit attached to the hospital, and that's not real common. I also know by the generous donations of the community and stuff, we are also remodeling our skilled unit.
Indeed.
Do you want to let people know what the importance of that skilled unit is, not for the hospital as much as it is for our community?
So first of all, I want to give a shout out to our generous donors. So this is largely 2 organizations. One is our Polly Ryan Auxiliary Group, which is our volunteers that have served this organization for many, many years. They have generously donated to the renovation of this facility for the last 5 years. And we are excited to be able to undertake the renovations that we've been planning for that period of time. The other donor is the Henderson Westendorf Foundation, which generously gave us a grant to complete that renovation of a facility that has been in place since the early 60s. So you can tell that it's probably time to do a little work on that. What is the value of a skilled nursing facility attached to a hospital is primarily a byproduct of 2 things. Number one, continuity of care. So the physician you see during your hospitalization will also be able to see you in the skilled nursing facility, regardless of whether they're a primary care or a specialist. In contrast, when you're transferred to an outside skilled nursing facility, an entirely new physician takes over your care, and the specialists are, generally speaking, not present in that nursing home. So most skilled nursing facilities are a part of a nursing home, not a part of a hospital, which is the case at OakBend. The second benefit and hopefully nobody has to use it, but it is a benefit in case you do, is you have the full backup of the staff that are on site at this hospital in the case that your condition worsens or your loved one's condition worsens. So let's take the hypothetical, if somebody has a cardiac event, a heart attack, we have a full code team, including an ER physician, that will respond to that heart attack immediately. So you are in a much better position in the case that something goes wrong to receive immediate life-saving care than if you're in a nursing home where there's no physician on site, especially overnight.
So, Joe, I want to understand you don't necessarily have to be in our acute hospital to go to the skilled unit. You can also be at another hospital.
Absolutely. And we get a lot of referrals from other hospitals. We offer a very high quality of care for a skilled nursing facility, and everybody knows that about our facility. So we're an attractive choice for folks, especially folks that may have some risk factors.
And I'll have to add to that, both of my parents had used our skilled unit, and the care was phenomenal. The compassion was amazing. And it was very convenient for me because I was able to see my loved ones without driving into Houston or anything like that. So thank you, because I know that the skilled unit is not necessarily, as you can see, most hospitals don't have skilled units. So they're probably not the most popular programs for a hospital entity.
That's correct. They generally do not make much money.
So I thank you for keeping to the commitment and keeping our skilled unit open. We also have a fantastic OB department, and it has a NICU. And that is a true benefit for this community. Would you like to expand on that?
Yeah, we have a wonderful OB department. It was built in 2009. It includes state-of-the-art design considerations. It's a very nice department, very nice rooms. The rooms have huge windows. It's very airy. We've got great staff that have been with us for many years, great physicians that practice there. Our neonatal intensive care unit, our NICU, is probably one of the more advanced NICUs in the county. We are we can go down to 32 weeks of gestational age for a premature baby, which is a benefit to our community, because if you can stay in the community, that is so beneficial to the parents, because the travel time and the challenges of visiting your baby every day downtown are almost insurmountable for some families. And this way, and the baby benefits hugely by that parental interaction, even when in a premature state. So we think we are very committed to the program. We're looking to expand it. We're recruiting 2 new doctors this year to hopefully help us build that program further and continue to provide those excellent services.
So there's one thing in the hospital I'm not sure our general community knows about unless they get to the point where they need it, but it's our wound care center.
Yeah, our wound care center, we've had our wound care center now for almost 15 years. For folks that have, generally, if you have diabetes, you're going to have trouble with blood flow to your extremities, in particular your toes and your feet and the lower parts of your leg. What that means is if you get any type of injury to those extremities, it will be difficult for the body to heal the injury, skin breakdowns and things of that nature. And so our wound care department uses advanced techniques for the treatment of wounds to help facilitate the healing process and get that skin cleared up. We go all the way to the point of putting you in a hyperbaric chamber where we pump in oxygen at pressure, which infuses the body with the healing effects of oxygen, which is a very important part in skin restoration. So we think it's a great program. We want to take it to the next level. So we've hired a nationally known management firm who is going to help us oversee this program and promote it into our community and build it up.
Awesome. And that's very important for our community. If you have a wound or something, the faster you get into wound care, the better your outcomes will be. And Joe, as of late, I hear we're starting a basically one-stop shop breast program.
Oh yeah, we've got a great breast surgeon, Dr. Steve Thomas, who is teaming with Dr. Amir Popatia, our oncologist, to create a wonderful, empathetic model of care that provides the very best in services that a woman could need in the case of breast cancer. Steve has many years of experience. We're honored that he chose to join our medical staff a couple of years ago, and we're looking forward to continuing to advance that program. We bought a bunch of new equipment so that we have the latest and greatest state-of-the-art tools to diagnose and treat breast cancer.
And I want to add to that that Dr. Thomas has committed to do same day to next day appointments. So our women don't have to wait. They can get in and start their treatment. So kudos to you and your team, Joe, for that program. We look forward to seeing that. Now, is it true that we're expanding services out at Wharton? And what is that going to look like?
So Wharton presently has emergency department services, X-ray, CT, ultrasound services, physical therapy, and we will be reinstating our inpatient services as soon as the staffing crisis that is afflicting the U.S. healthcare system abates. But beyond that, we have a desire to open up more elective surgery types. So presently we do elective eye surgeries, and we do colonoscopies and endoscopies. What we look forward to doing is general surgery cases, again, on an elective outpatient basis, as well as orthopedic cases. And we want to continue to expand our offering of cardiology services, both diagnostic as well as treatment.
Awesome. And I understand that you're doing a build out.
We're building out the front right-hand quadrant corner, I should say, of the building into Class A clinic space. So you'll be able to walk in that front entrance and right there to the right, very convenient, freeway access, freeway visibility. And we think it'll be a great tool to attract physicians to serve the community.
So it looks like you've been working hard, even though we've had COVID in place. We've got new programs and expanded on our old programs. You also do stents.
Cardiac procedures, including we put in stents to open up blockages in the heart, in the legs, where there might be blockage that's associated with vascular disease or coronary disease, heart disease. So yeah, we do that. We have a heart attack program. So if you have a heart attack, the ambulance will take you to OakBend and we'll get you right into the cath lab and relieve you of that blockage.
And then we have a stroke program, and we use telemedicine with that.
Yeah, it's a great program. So the historical model for treatment of strokes is a patient would come in with stroke symptoms, and the neurologist would be contacted via phone, and the ER doc would describe what he or she is seeing and hearing, and the neurologist would make a diagnosis over the phone. We have now been blessed to have new technology that really takes it to the next level. So we have basically a cart with a high definition camera and screen on it, and they will roll that in and they will talk to the patient. And the neurologist that does nothing but handle stroke cases is on the other end of this technology. And so the subtle signs that a person is experiencing a stroke, which may be not visible to a less trained, somebody that doesn't do strokes all the time, will be picked up by that. The physician can amplify the sounds coming out of the stethoscope, can slow down the picture, can speed up the picture, can do all sorts of manipulations that greatly enhance the physician's ability to diagnose the stroke, while simultaneously sitting at a computer looking at any imaging studies that have been done of the patient, the CT, the X-ray, what have you, and any lab results that have been produced to that point. So it is a much better tool for the diagnosis and treatment of acute stroke than anything we have had previously. It is the standard in the industry now to provide teleservices, not to rely on a community neurologist for that.
Great. Joe, 63 years ago, this hospital was established by community and the George family to take care of this community and put patient care first. 63 years later, you have been committed to keeping that same commitment, whether it made financial sense or not. I want people to hear your passion for patient care and how the board and you work to make sure that we keep our traditions in this hospital?
Yeah, so unbelievably, the world has changed in amazing ways since 1947, but in one very important way, it hasn't changed. We still need local healthcare services to provide the very best in treatment to our community. And I say this because a very important part of healing is your mind and how you feel you're going to progress in your treatment. And the farther you have to travel, the less you can engage your community to help you in the healing process. And your community, your friends, your church, your neighbors, they're the ones that lift you up when you're struggling to recover from whatever might have caused you to seek healthcare services. I believe firmly that independent hospitals are more connected to their communities. We don't rely on any other community. This is it. If we don't serve this community well, then we have no future. That gives us a laser-like focus on what do we need to do? What does this community need that may be unique from another community or may not? But we need to make sure that we stay focused on how we serve this community to the very best of our ability. And we take care of everyone in our community, regardless of their ability to pay.
Joe, there's so much that goes on. You've done such a wonderful job leading this hospital to where we are today. And from someone from this community, it means a lot. Is there anything you want us to know about OakBend that we haven't covered?
There's one little seen thing that goes along with having a community hospital that is not always appreciated until you don't have it. But a hospital serves as a magnet for all sorts of other healthcare services, whether it's pharmacies, durable medical equipment providers, physical therapy locations, imaging centers, surgery centers. They all congregate around a hospital so that they have ease of access to the higher level of care services that a hospital offers. And so you build an ecosystem of healthcare providers that serve as satellites around the mothership called the hospital. And we serve that purpose for the Richmond, Rosenberg, and Needville and Wharton communities. And we're proud of doing that. And we want to continue to do that, not only for the hospital services we offer, but for all the other associated healthcare providers that follow a hospital wherever the hospital may be located.
You know, Joe, sometimes people have questions and struggle. Do I go to OakBend or not? I understand that you have an open door policy where you will give tours of our facility, and you're always striving to do the best, and your staff supports you in that. So I would entertain anyone wanting to have a tour to come and see the operation and meet the people before you make an opinion, because it is a fantastic place to get medical care.
Speaking of appearances, we have created a warm environment, as warm as any hospital could be, not because of its appearance, but because of the benefit it provides to our patients in terms of creating a healing environment. If you think about it, the more anxious you are, the higher your blood pressure goes, the higher your heart rate goes. Nothing really good comes out of anxiety in a healthcare setting. So we've got natural wood grain looking laminate on our doors and cabinetry. We have muted lighting. We have wood grain flooring, all designed to make it a very comfortable feeling, or again, as much as a hospital can be a comfortable feeling. And one of the things I failed to mention that I always want to point out when people are considering a healthcare provider is we have the only no-wait hospital emergency department in the entire Houston area. And if you haven't sat waiting 3 hours to get into an ER in the course of your lifetime, it's going to happen, but not at OakBend. You'll come in, we will register you, we will take you immediately to the back and begin your treatment protocol. Now, dependent upon your condition, you're not going to get out immediately, but you're going to shave off of the total time that you spend in our emergency department a good hour to two that you would have otherwise waited in another facility.
That is amazing. And I've used those services and it makes a huge difference. So, Joe, thank you for joining us today. And a big thank you to all of our listeners for tuning in. Beginning now, set an intention and a relentless focus on living your life as the greatest person you can be in all situations. Please join us next week. And again, belated happy birthday, Joe. We look forward to having you on again.
Well, thank you very much, Donna. It's been a pleasure visiting with you and your listeners, and I look forward to the next opportunity to do it again. Please stay safe and be well.
Thank you for joining us today on OakBend Medical Center Happy Hour podcast. We hope you enjoyed today's broadcast and invite you to email us at oakbendhappyhourpodcast@obmc.org with any questions or topics that you would like for us to cover. Remember, you can find us here each Friday at 5. Until next week, be mindful and stay healthy.